Hi there, Mark Jabin here, Medical Director of the Haywood County Health Department, and let's talk about this pandemic. Time for our weekly update, and this is being recorded on Saturday evening. So in this video, our day in the sun, the numbers, where we stand, and the Peanuts comic strip weighs in. So first, kudos to local businesses doing their part to help us be safe and stay open. And today, thanking Laurel Ridge for what they're doing in their main building, and the Pisgah Inn. Kudos, nicely done to both of you. And now to the numbers. Total cases are now 421 on the North Carolina database as of tonight. At the health department, we're at 363, and this represents the lag until we can confirm these positives. The gap has come about due to the rapid increase in cases over the past couple of weeks, and is strictly just a workforce issue. As doing the contact tracing and contacting people who are positive is really a time-consuming process. Please see the update COVID message number 24 out at the end of that week for more explanation about that. Recovered so far are 248 of those, and we're obviously very happy about that. Positive currently in isolation, 115. In quarantine, 209, which gives us a COVID number of 324, and as you can see, up quite a bit from even a week ago. And I'm sorry to say this will go higher given that lag in cases that we're seeing. Since July 28th, there have been 128 new cases, and this includes a cluster at the hospital. It also includes what's going on at Silver Bluff with an additional 49 residents and 22 staff over this time. But most importantly, from a community spread perspective, only 5 family members of those staff have tested positive, so that's really good. We also note a second long-term care facility in the county has 2 cases that are positive but unrelated, so it is not considered an outbreak. There are some other test results to come early this week, so we'll see what happens there. Now, of those 128, there are an additional 34 people positive since July 28th, unrelated to either of those groupings. And of those 34, all have known exposure to someone positive except for 3. Confirmed deaths, there are 12 on the North Carolina database, but I'll tell you there are at least 3 or 4 more going through official channels before they will be reported. As far as hospitalizations, North Carolina is flat. And Haywood Regional has seen somewhere between 3 and 10 cases all along. That hasn't really changed. There are an increase in the number of positive cases over the last week or two. And Mission and both Haywood Regional still have adequate capacity at this time. The positive test rate in North Carolina is 8%. Here in Haywood County, 11%, which should be no surprise given what's going on here. Now, what about in our neighboring states? Cases in Florida, South Carolina, Georgia, and Tennessee are all lower than last week. However, all are still high and in the red zone by both White House Task Force criteria and the Harvard Global Initiative criteria. And I'll make a point of saying that the bordering East Tennessee counties to us are all in the red zone by both criteria. So where do we stand? You can see on the graph here, North Carolina at 15, cases daily per 100,000 population, but look at Haywood County. And real interest, look at the other surrounding counties, all of which have gone down here over this last week or so. Now, for so long, we in Haywood County were ahead of everyone else, but now, unfortunately, we're having our day in the sun. On the good side, though, much of our increase is condensed to a few groupings, giving us still a good opportunity to tamp this down. And right now, that is critical for the next few months. If we can get the level of cases down low enough, then the next wave doesn't carry us even higher. Now's the time. So please give some thought to what you will do to contribute to the health of our community. And especially, if exposed, participate in contact tracing. We're not here to bust people. We are here to bust the virus. And think of it this way. Remember Pigpen? Surrounded and covered, this time in a cloud of virus. If this is you, avoid sharing the cloud. And if there's someone you are around, avoid being in their cloud. Avoid being close contact or contributing to someone else being in close contact. That way, you won't have to isolate or quarantine if you come close. That's the best way for you to keep working, keep your business going, keep schools going, and keep the economy going. So please share this video with someone you care about. Be well and be careful, especially right now.